Good afternoon, everyone, and thank you again for joining us for today's webinar, Eviction and Homelessness Prevention as a Critical Component of Community Preservation and Housing Equity for Low-Income Renters. Today's presenters are Daniel Farrell, Renee Fuller, and Tina Goodrich. Mrs. Goodrich has over 20 years of experience in the fields of affordable housing administration and homeless service delivery. Most of her initial experience in the area of government subsidized housing and services came during her 9-year tenure at MBD Community Development Corporation in the Bronx. Mrs. Goodrich made the transition to operation of NYC Department of Homeless Services, DHS, shelters in 2006 with VIP Community Services. She had served in various capacities in DHS shelters over the last 11 years, including the last 8 with the Help USA Women's Center in Brooklyn, serving as the Director of Housing and Director of Social Services. Mrs. Goodrich currently serves as the Program Director of Help New Beginnings Critical Time Intervention Program, focusing on positive outcomes for young heads of households at risk for homelessness. Renee Fuller is the Executive Director of Help USA Homebase Homeless Prevention Network. Ms. Fuller successfully directs and supervises the overall operation of the Help USA Homebase Homeless Prevention Program. Help USA is a nonprofit organization based in New York City. The homeless prevention programs are funded by NYC Human Resources Administration. Since the introduction of Homebase in 2004, Ms. Fuller has developed models for intervention which will provide prevention, diversion, aftercare, case management, and support services to individuals and families likely to seek shelter services. Ms. Fuller has 31 years of experience in the field of social services. She holds a bachelor's degree from Syracuse University and has completed coursework in social welfare policy at Hunter College School of Social Work. Daniel is a Senior Vice President of Assessment, Diversion, and Research at Help USA, an American nonprofit provider with programs that provide transitional, permanent housing and homeless prevention services to people at risk, literally homeless, and formerly homeless adults and families. Daniel is responsible for multiple transitional housing, shelter and homeless prevention, rapid rehousing programs in multiple U.S. cities, including New York City, Philadelphia, and Las Vegas, serving over 10,000 homeless or at-risk single adults and families each year. He is a graduate from the New York Institute of Psychoanalytical Self-Psychology. Thank you all for joining us today, and I'm going to turn the presentation over to Daniel.
Thank you, Colleen. Thanks, everyone, for joining the webinar today. So today, Tina, Renee, and I will talk for about 45 minutes about homeless prevention, eviction prevention, and the differences between Philadelphia and New York, and then wrapping up with some of our successes that we have with our home-based programs in New York City, the Bronx specific. So if we're on slide 2 of the presentation, just a couple of slides here on the eviction, the formal and legal housing eviction difference between the cities of New York and Philadelphia. So you see here on the slide, citywide in Philadelphia, on average in 2015, one of 14 renters are evicted every year, a rate of almost 8%. And those numbers come from housing courts, so the number is clearly higher than that from informal or non-legally driven evictions. The total number of legal and formal evictions was just under 20,000 for 2015. The neighborhoods most affected with eviction rates well over 10% are neighborhoods like Grays Ferry, Point Breeze, Elmwood, King Sessing, Oak Lane, and etc. And as we know, unfortunately, as Matthew Desmond's work has really pointed out, starkly racial disparities are clear. Neighborhoods with high concentrations of African American folks experience higher rates of evictions. So in New York City, from that same time period, next slide, Colleen, from 2010 to 2015, about 1 in 50 renters are evicted each year, about 2% as opposed to just under 8%. And that's a 24% decrease of the number of legal evictions from 2013 at just under 29,000 to 2015 at just under 22,000. And the most recent numbers for 2017 is that number continues to go lower. It's about 21,000 even and we do expect in New York for that number to go down even further, as the New York City Council has passed a bill about a year and a half to 2 years ago requiring that all tenants in housing court have access to a free attorney. And we're just starting to see that's just starting to come to fruition now, as a lot of the legal nonprofits have been staffing up over the last year or so. So New York City is by population, about 5 times larger than Philadelphia, but has roughly the same number of actual evictions. The difference of only about 1 to 2,000, which is stark and scary. So a tale of two cities on slide number 4. Rent protections historically are higher in New York City. The number of rent-controlled and rent-stabilized apartments is proportionally much higher. New York City has over 1 million rent-controlled and rent-stabilized apartments, while New York City loses a certain number of those apartments every year. They're still proportionally higher than Philadelphia has. And homeless prevention efforts are more robust, and that's where Homebase and our efforts come in, and we'll talk about that momentarily. And like I mentioned, enhanced legal services for renters. Right now, and this was really last year, 1 in 4 folks in housing court were represented by legal services as compared to 1 in 100 just a few years ago. And that percentage is probably going to go down as well. It'll probably be 1 in 3 this year and maybe 1 in 2 next year. So slide number 5, moving into literal homelessness to talk about, as providers of housing-based services, all of us on the call, we know that literal homelessness is the most destructive element of our work, that someone experiencing literal homelessness is to be avoided at any and all costs. And it's such a disruption to one's life at many different quantifiable and really non-quantifiable levels. Next slide, social costs. So let's quantify them a little bit. Frequent use of shelter include an increased medical and mental health services, and also public corrections. For folks who remember the New Yorker article back in, I think, 2005 or 6, Million Dollar Murray, which highlighted chronic homelessness and the chronic use of multiple and varied systems. Homeless folks themselves talk about a social disadvantage in all aspects of life, and a stigma, a large stigmatization of being homeless. Next slide. Individual costs. The incidence of sexual abuse and violence is much higher for youth under 18 who are homeless than their non-homeless counterparts. Homeless adolescents are much higher risk for substance abuse, delinquency, victimization, physical and mental health problems, and single homeless adults experience a greater incidence of substance abuse and mental health. All of these kind of outcomes are well known and well documented, these unfortunate outcomes. Next slide, legal costs. We know in our country that kind of a right to one's own place requires really a key to a door. So literal homelessness, whether in shelter or on the street, strips basic liberties and equalities, as people experiencing homelessness lack in some ways, basic legal and social acknowledgement by our society. It's not true in every country, but it's true in this country. People who are homeless lose their right to property, personhood, and protection against illegal search and seizure. So as we know, any shelter providers or folks who work with the street homeless population, that folks living in shelter can be searched, their belongings can be searched at any time. They don't have that same legal protection that we do who are housed. And lastly, homeless is equated to being subjugated by the law in virtually all capacities. All the local ordinances are really about, and the vagrancy laws are really about pushing and moving people along. Next slide, and then lastly on this, we're talking about subjective experiences in shelter. There are some sociologists and anthropologists that have done work, qualitative interviews of people living in shelter, and consistent responses included feeling objectified and infantilized. Many folks living in shelter feel that shelter workers do not always or mostly have their coming from a client-centered perspective. And that shelters, as we know, whether it's in the Commonwealth, whether in New York or Las Vegas or LA, they're generally constructed to ensure basic needs are met. But how can we at a deeper level really offer like trauma-informed care and things like creative arts therapy and social workers. Those are expensive things which funders generally see as add-ons. I don't see it that way, but that generally is the way I think it's viewed. And then lastly, in the next slide, Colleen, slide 10, determining risk factors of homelessness, which is important from a homeless prevention model, which Renee will talk about momentarily. So determinants of homelessness are complex, multifaceted, and ever-changing, as we know from the literature that people who are evicted don't necessarily become homeless right away. It's a long cascade into homelessness. Some folks do become homeless right after they're evicted, but most often it's the first real marker toward homelessness. People may end up on someone's couch. They may end up on someone else's couch. They may move to a different city. All of that begins to kind of cascade downhill. So we see the cascading effect of multiple risk factors, and without the sufficient protective factors as a counterweight, then people can kind of steamroll into homelessness. So lastly, on that slide, a convergence of multiple unfortunate macro factors like domestic violence, substance abuse, lack of social supports, and macro factors, a very hot housing market like New York City, like San Francisco, like D.C., and like Philadelphia is becoming, and a destabilizing event like a loss of income, like an eviction. Kind of add those together, and the chances of literal homelessness are much, much greater. Now I'd like to pass it along to my colleague, Renee Fuller, who will go into a discussion about our home-based homeless prevention programs.
Good afternoon. I'm Renee Fuller, and I'm the Executive Director for Help USA's Homebase 1 Homeless Prevention Program. Help USA is running 3 of these programs at this time. As Daniel had said earlier, Homebase is a homeless prevention model that was started in 2004. Since then, we have gone through several changes, but it has proven to be highly effective at helping people to avoid a shelter stay by introducing them and educating families to know about the resources that are available to them within their near communities or within the city. And these resources can definitely help them to access what they need in order to resolve their housing crises. The mission of Homebase is to try and avoid a New York City shelter stay. Many people who go into shelter or apply to shelter do so because they're not knowledgeable of the resources that are very often right in their backyard. They will listen to word of mouth or experiences that other people have had, and out of sometimes shame, sometimes just not knowing, they will just pack up and just go to shelter. More often than not, there are other resources and other options out there to avoid a shelter stay. Most of the folks that come to Homebase are coming to us with rent arrears. They're backed up in rent and don't see an option as to how they can catch up or to pay the large amounts that have built up over time. We also have families and individuals who are living in what we call doubled up living arrangements, and that means that they don't have their own apartments, but they're staying with family and friends. And very often after a certain period of time, that living arrangement becomes no longer viable. We also have received plenty of folks that come with notices to vacate due to illegal or unlivable situations. We also get emergency relocations for situations like domestic violence or natural disasters like Hurricane Sandy. And people also come to us looking for ways to obtain rent subsidy assistance to be able to afford their rents going forward. And we are able to assist finding these subsidies or helping them to apply for these subsidies for those who qualify. Homebase also runs a rapid rehousing and a diversion model. And what that is for people who do end up going to apply for shelter, they are assessed to see if there's possibly any place else they can stay besides entering into shelter. If that seems like a possibility, then Homebase steps in and helps these families to identify and locate families or friends where they can stay for a while we work with them on finding their own places to live. We assist the client with locating these other families. We verify the ability for them to stay there. We assist the family while they're there. We help them to find a suitable rent assistance subsidy. We help them to look for an apartment that will take this subsidy. And then we help them to transition in from their temporary housing arrangement into their own permanent living arrangement. One of our newest models is our aftercare model, and that's something that's very important in New York City. We assist families who have recently moved out of shelter and into permanent housing. And what we do is we really want to make sure that now that they're out and into their own permanent living arrangements, that we try to help them to connect with their communities so that they don't end up returning to shelter. We help with their transitions into their new communities. We check in with them to assist them with staying on track and trying to prevent evictions if they should arise or any other housing issues that may come up. We also assist with connecting them to their communities and making sure they know what's available to them, where their schools are, where service providers are, and all of these things when they result in promoting housing stability for these families. And our next slide. One of the most important tools that we use in identifying our clients is we use a targeting tool. It's really important to use a targeting tool in order to try and identify those families and individuals who are not only just having a housing crisis, but those who are most at imminent risk of entering into shelter. Everyone who's facing eviction or ends up in housing court is not on their way to a shelter. So what our targeting tool, which is called a risk assessment tool, we use that in order to try and identify those families that, if not for assistance from our Homebase program, that they will be on their way to apply for and possibly be found eligible for our shelter system. Our risk assessment quotient is a questionnaire made up of questions that have been found to be directly correlating to those who are at highest risk of entering into shelter. Our families and individuals must score a 7 or better on this risk assessment tool. Those who score a 7 or better, they usually are young moms. They've usually had a shelter stay. They are able to prove through documentation that their current living arrangement is no longer viable. Score a 7 or better, that will help them to be eligible for the Homebase program. The risk assessment tool also shows where there is severe household discord. That could be within the household itself. It could be between the family and the landlord. But it also, those positive answers to those questions also show that that person or family will be at a higher risk of being found eligible for shelter should they apply. 2 or more of the individual factors as a child will be, that they had experienced homelessness when they were young, that they had been a part of the foster care system, that they may have been physically, sexually, or emotionally abused. They usually have moved 4 or more times, and more often than not, the family is on public assistance currently and has been so as a child. The risk assessment quotient it's a weighted system. For most of the questions, there's 1 point for each factor. At the top of our list, the head of household is usually between 23 and 28 years old. Again, they're usually receiving public assistance. They usually have been involved with children's services or foster care. They usually have had a shelter stay in the past 3 months. As an adult, they usually have had a shelter stay as well. They usually have experienced 1 to 3 moves in the past year. They usually have some sort of moderate or low to moderate household discord. They usually are not a leaseholder, and they usually also may have returned from being in prison or having a substance abuse issue. Targeting really helps us to assess the risk or threat to their current housing stability. Homebase has been very successful at targeting these families. And by targeting these families and avoiding a shelter stay, it helps to bring down the numbers in our own shelter system. Homebase is a way to we step in. We're able to provide financial assistance to these families, and we're also able to help to connect them to the other resources, like our own Human Resources Administration. We are able to connect them to other resources for those who, like for example, those who come in for domestic violence. We're able to successfully connect them to those resources, for educational resources, for employment resources. We have a number of activities where we do provide workshops. We provide counseling. We refer for counseling, all of those things that help to contribute to how they ended up in the housing crisis themselves. We also are able to go in and to advocate for them for benefits. We advocate for them with their landlords to make necessary repairs. Those are all definitely factors that will help them to be able to remain stably housed in their homes rather than to enter into a shelter stay. Our families, our population at Homebase are made up of families with children, and families with children have at least one child under the age of 18. We also assist adult families and adult singles. In those families, there are no children under the age of 18. Our families with children, they have to have a public assistance case or active food stamp case, and their total household income cannot exceed 200% of the federal poverty line. For our adults, singles, and our adult families, their total household income cannot exceed 30% of the area median income. For the citywide Homebase program, there's 23 programs, and there's at least one in every community. We are split up by zip codes at this time. So there is a Homebase program in every community in New York City at this time. Next slide. We are also able to provide financial assistance, as we were saying before. We help folks with rent arrears, security deposits, furniture, moving expenses, ongoing rent contributions, work expenses and training. So folks will come in with rent arrears. You know, people fall into rent arrears, and most often than not, the families that come into us, it's not always because of negligence. You know, sometimes there's a choice between feeding your children and paying the rent. And rent, usually, they always have intentions they're going to catch up next time. And then the arrears build up to a point where they're not able to pay. So Homebase can step in. We work closely with our Human Resources Administration, and then if need be, then Homebase can provide short-term financial assistance to make up the difference. We also assist with security deposits when we have to relocate families, broker's fees as well. We can provide furniture for families where furniture is needed. For relocation, sometimes we pay for the moving expenses, the truck, whatever is needed there. On occasions, we can also assist with ongoing rent contributions. So, for example, if someone had lost employment and has another job lined up, but they need something to bridge them until the point where they get their first or second paycheck, we're able to do that. We encourage working here, so we also assist with work expenses. Maybe they need a uniform, they need a Metro card in order to get back and forth. They may need a training in order to be prepared for this new employment. They may need an application fee in order to apply for a training or for something for a job. We're able to do that. We also provide incentives, and this usually comes into play when we are working with our diverted clients from out of shelter. We divert them to another family where they can stay while we assist them with finding their own housing. So we are able to provide what we call the primary tenant or the primary leaseholder with an incentive to please keep them there while we continue to work with them. We always lever our financial assistance with other existing funding sources, primarily our Human Resources Administration. There are other anti-eviction programs that are located throughout the city, and we work closely with them as well. We offer workshops such as money management, and household budgeting seminars. We offer them on site, and we're able to refer. We have partners that we work with within the community just to help folks to re-budget, to look at things differently so that they hopefully will not fall back into the same situations that they are currently in. We provide housing court assistance. We have what we call a housing court liaison that's located in our housing Bronx Housing Court, and that person is there for our clients to help them to navigate through Housing Court. I don't know how Housing Court is in Philadelphia, but in New York City it's quite busy and very overwhelming. And it's often very, very helpful for our Housing Court liaison to work with our clients there, to tell them where they should go, to help to speak on their behalf, and definitely to speak on behalf of the home-based programs regarding what our steps are, our intentions are going to be to help the client. It helps to buy the client more time while we continue to work on resolving the issue. And we do, like we said before, we rehouse or divert when appropriate. If the apartment is not livable, then we will work with that client to find them a more suitable and safe place to live. Next slide.
Okay,
Dan?
so I'm going to go through, so thank you, Renee, for providing a deep dive into all the services and the varied services that we've been doing for about 14 years now. As government entities and all sorts of other non-governmental funding streams want to know, how can we quantify the success of a program? So if we go, Colleen, to the next slide. So we added a research question here. Did a homeless prevention program reduce shelter entry? And this is not necessarily just for our home-based program, but really for all citywide programs, but the numbers are based in ours. Next slide. So this data comes from fiscal year 17, July 1st of 2016 to June 30th, 2017. We served almost 4,600 unduplicated families and just over 1,000 single adults. And as you can see at the bottom, just under 95% of those folks did not enter shelter 1 year after enrollment. That's how the City of New York quantifies success. And I do want a little asterisk here is that in New York City there is a right to shelter, so there's more of a draw than in other localities. So if for anyone who requests shelter, they must be bedded that night. And New York City shelters have increasingly gotten better through the years, which of course is a good thing. Next slide. So quantifying what a shelter stay costs for an average family. In New York City, as we know, as all throughout the Northeast, becoming so expensive in the housing and rental market, shelter is no exception. So shelter costs approximately $73,000 per family for an average length of stay, which is 434 days in that fiscal year. That's $168 per night for a single adult. It's about $95 per night, and the average stay is about 13 months at $38,000. In FY17, we had an investment of almost $9.5 million in Homebase. In this fiscal year, we went up to over $13 million. So the Homebase cost per family is just over $1,600. Next slide, Colleen. So the literature has been pretty clear. There are some more articles out there that quantifies the success of Homebase. The way that it's quantified, though, is not specific. It's approximated. Hard to know exactly who would have become homeless and who would not have become homeless if not for Homebase's intervention. So the results are generally approximated. So Mazzari, O'Flaherty, and Goodman estimated that shelter entry falls about 10 to 20%. And then Ralston, in their seminal study in 2013, guessed about 6.5. Actually, that number is 8.9% reduction. It's just under 9% in their shelter stay. My apologies for that error. So if you go to the next slide. So in FY17, we served over 5,600 family units, unduplicated. And on the left hand of the bottom column, on the most liberal side, if 20% of those families would have become homeless without our services, it's 823 more families. 303 families of ours did become homeless. Still, over 800 families would not have become homeless for the savings of over $45 million. But that's probably a little too high of an estimate. Going down the scale, if 15% more would have become homeless, that's over 500 families that would have become homeless for a savings of just under $27 million. But even if we go more conservative than that, at 10%, that's 260 more families would have become homeless for a savings of $8 million. And then if we go at the most baseline at 8.9%, that's still almost 200 more families with a savings of just under $4 million. So next slide. So can we positively say that that homeless prevention caused a decrease of shelter entry and reduced length of stay for those who didn't enter shelter? Or more likely, again, as we approximate our knowledge with this, or did HELP's home-based prevention program possibly lower shelter entry for some clients? we at HELP, we tend to think it's probably between 10 and 15% more people would have become homeless, maybe 12, 13%. That's our best estimation based on our kind of anecdotal knowledge and work, and based on, on a middle ground of the literature. And of course, there are other variables that affect shelter entry rates and homelessness in general, of course. And so next slide, Colleen. We know that homelessness prevention, while not a unique American phenomenon, it hasn't really taken off in this country, but it has taken off in other countries. In Canada, the federal government just announced and just put out a roadmap toward establishing a homeless prevention network nationwide, which is fantastic. Homeless prevention in the small country of Wales is an actual legal right, that before someone not only gets evicted but may become homeless, that the local government must intervene by law. And then homeless prevention programs do exist more robustly in countries like Germany and England. And we know that some writers like Mary Beth Chin and Kim Hopper have been saying that we in homeless services need to go further upstream and talk more about housing preservation. And then lastly, for me, before the last part of the presentation, next slide, Colleen, is homelessness an economic rational choice, meaning that, as Renee really touched on, for many people living in poverty and on the margins, they have to make these draconian Sophie's Choice-like decisions when it comes to where do I put my money. So at Christmas time, at the holidays, we see a lot of people spending more money on gifts than they do on rent. When school starts, we see that people spend more money on school supplies and clothes for their children than on rent. It's perfectly understandable. And that what if people didn't have to make those choices? What if there were a guaranteed income, let's say, or a wage that didn't require people to work at so low wage that they didn't have to make those kind of draconian and Sophie's choices with their income? The outcomes would probably be stark and different. And I'm going to skip over the next slide. And then the next slide we lead right into, like I said, the last part with Tina Goodrich.
Hi, good afternoon, everyone. I'm Tina Goodrich, the Program Director for New Beginnings, Help USA Critical Time Intervention Program. This program is funded by the Robin Hood Foundation. Colleen, next slide. So what we're going to look at is the behavioral economics offers a unique perspective into the phenomenon of homelessness. By understanding how and why individuals are forced to make choices that may result in a housing crisis and or literal homelessness, this method offers insight into how upstream interventions through curating of critical time choice sets can be preserved housing in the long term. And this goes back to what Daniel talked about, where households have to make a choice around Christmas time and or school time. Do you buy school supplies or gifts versus do you pay the rent first? So New Beginnings, we focus our target population, we focus on the young adult ages 18 to 24 who are head of household with children whose case is being resolved by Homebase. Next slide. We look at the normative life events that are stressful, which include day-to-day hassles, marriage, residential relocation, and change of job. Then we look at the non-normative events that are unduly stressful, unpredictable stresses, which can lead to poor decision-making processes, especially with young head of households. We look at poverty, maybe loss of income, wages, trauma, domestic violence, and those who experience a history of homelessness or institutionalizations. Next slide. So New Beginnings is a single point of access for young head of households that come through Homebase who are exiting the Homebase program. Once the housing crisis is resolved, the case will be handed over to the CTI team, and that's where the clock starts to tick. CTI comprises of 3 master-level clinicians, and it tends to increase positive outcomes for young head of households who are at risk for homelessness by focusing on an array of options made available. This is through education, employment, income supports, health care, and or daycare. New Beginnings work directly with primary leaseholders to ensure rent is being paid, and also secondary tenants who reside double up. That's when Homebase come in, which Renee spoke about, where a financial assistance can be provided to the tenant and the primary leaseholder. And should a client enter shelter, the CTI team will respond rapidly and quickly exit the client out of shelter if possible. And not only does the CTI team focuses on areas discussed above, but other barriers that requires clinical in nature, and that's domestic violence, history of trauma or chronic homelessness, and it's more of a clinical grounded model focusing on CTI and enhanced by therapeutic alliances for each client. It's important the client knows that both teams, Homebase and New Beginnings, are working together. Next slide, please. So here, let me just go back just quickly about the CTI. CTI is also done in 9 months. It's critical time intervention broken down in 3 phases. Each phase is 3 months. The first phase is the transition part, which is intense period of engagement. This is the most intense period part of CTI where bulk of the work is engaging the client, addressing crisis, and assessing for potential long-term support systems. Phase 2 is the tryout. It's less frequent meetings. You adjust systems of support for the client. We monitor the effectiveness of supports and intervene as needed. Phase 3 is transfer of care, graduation period. The work that was done in the last 2 phases, we fine-tune, we monitor, and ensure that the client's able to navigate these systems on their own. And that's when they will graduate the CTI program. Next slide, please. So right here are some of last year's results and goals that New Beginnings worked with in ensuring our clients attain residential stability. We focus on education, employment, increase of income, child care, and health care. Next slide, please. And on this slide right here, what we did is we broke down the types of clients who come through Homebase, whether they have a voucher, if it's aftercare, prevention, diversion, or NYCHA, which is also part of, similar to a voucher where it's 30% of a client's income. And last year we had 108 clients that were part of prevention, diversion, 79 at immediate risk, that was prevention. 3 were diverted who entered shelter and diverted back to family or friends, while Homebase and New Beginnings worked to resolve the housing crisis. And then we had 26 who actually had the aftercare link or NYCHA voucher. I'm sorry, all these numbers add up to the 108 clients at that time. Next slide, please. So going forward, New Beginnings, we are in our 2nd year. And this year, we are looking to enroll 200 head of households. We have a evaluator, researcher on board, which will compare the 2 home bases that are receiving New Beginnings CTI services versus Homebase Help USA Homebase 2 who are not. Then we are screening for depression using a PHQ-9 form. This is for young women who are pregnant, and the immediate concern is prenatal care. And the clinicians should be ready with suggestions for the head of household regarding appropriate health care providers for those clients who are pregnant and or gave birth during enrollment. So overall, the key success to CTI is the intervention in creating appropriate and effective links to community resources so that individuals can play an instrumental role in supporting families upon completion of the program with tangible supports when it comes to income, health care, primary care, education programs for both head of household and or children. And that's about it for New Beginnings.
And that concludes our presentation of kind of an overview of New York City and Philadelphia, an overview of homeless and eviction prevention, and an overview of kind of a new program that's meant to help young heads of household further upstream to help promote long-term housing stability and not just work in a crisis mode. So thank you everyone for joining, and we look forward to any questions or comments.
Great. Thank you, Daniel, Tina, and Renee. We did have a couple of questions come into the chat box throughout the presentation, so we'll address those first. We had a question from Jeremy. If folks are doubled up while in Homebase and not qualified as homeless, are you not using HUD funding for the rental subsidy?
Good question.
Dan, you want to take that?
Renee, do you want to take that one?
Okay. A lot of our funding comes, the majority, let's say, of our funding comes from HRA. And most of our funding is what we call city tax levy money. So yes, we are able to assist folks who have not been deemed as homeless under HUD. And for those who are not aware of that, when they are able to be labeled as homeless under the HUD guidelines, they have to show, they have to demonstrate that they are facing homelessness within a 2-week period. No, we don't have to follow those guidelines. However, again, we work with our risk assessment tool, which is our targeting tool, to find folks who are at imminent risk of entering into a shelter, and that kind of, I guess, follows sort of the same route without having the exact same criteria.
Great. And then Jason asked if you would be able to share a copy of the entire risk assessment tool.
That's always the question, and I can't share it with you. If you're interested in knowing more about that, then we can get information to you of how much it comes from HRA. So I personally can't share it with you, but HRA may be able to provide you with something.
Colleen, I'm happy to have a conversation with you and see if I can get it released. I don't think it'll be a problem.
Okay, great. And we can I can send that out to everybody on the webinar today if it's able to be released. And then we did get a question. We will send out a copy of the recording of as well as a copy of the slides early next week. And somebody asked, are we working on a program similar to this for the entire state of Pennsylvania?
So there are a few of us here in Philadelphia and beyond that have discussed it. Montgomery County, while small, has implemented a robust homeless prevention program, and a detailed report was released recently. And Colleen, I'm happy to send it to you to send it out. I thought it was a really good report. Is it done citywide, let's say in Philly or Pittsburgh or across Pennsylvania? It is not. We have successfully lobbied the Philadelphia City Council for some prevention money, which was released last year. It wasn't much. It was less than $1 million, but it was helpful.
Great. And I believe the report you're referring to, Daniel, is the EPIC solution report?
I believe so, yeah.
Yeah, so we can send that out along with the copy of the slides. If anybody would like to ask a question over the phone, you can unmute your line by pressing *7 on your phone keypad. And we can also take questions through the chat box as well. We do have a few more minutes for any questions, so if you have any questions, feel free to just unmute your line by pressing *7 or typing them into the chat box. If there are no more questions, we can end today's webinar. I want to thank Daniel, Tina, and Renee again for joining us and presenting today.
You have another question.
Yep, there was one more question that just came in.
Two more.
Jeffrey asked, is the targeting tool available for review? So we did address that, and we will be, Daniel's going to see if that will be able to be released. And if not, we can try to get you in contact with the presenters today. if there's not any more questions, we're going to end today's webinar. So thank you again, Daniel, Tina, and Renee, and thank you for presenting.
Thank you.
And thank you everybody for joining. And I also want to let everybody know that the Housing Alliance's conference, our Homes Within Reach conference, is going to be October 29th through the 31st. And our early bird deadline actually ends today for registration, and we'll be taking registration after today. But just wanted to let you know that that conference will be happening at the end of October. And thank you everybody again for joining, and have a great rest of your Friday and a great weekend.
Thank you.
Thank you. You too.
Thank you.
Thanks, everyone.